Hi, I'm Dr. Preeti Reshamwala, consultant dermatologist and hair transplant surgeon. Today we'll be discussing on the topic of vitiligo on the event of Vitiligo Awareness Day. Vitiligo is not a contagious disease, but it's an autoimmune process, and the treatment varies mainly depending upon the age of the patient as well as the duration of the disease and other medications or therapies taken in the past. So coming to the therapy as well as the medications which are given, if the lesions are localized, then and again the age group is like a pediatric age group, then we consider topical applications like corticosteroids, which is mainly indicated for small patches. And there is something known as immunomodulators like tacrolimus or pimecrolimus, which helps to control the disease to a good extent. Apart from them, there are some therapies like the light therapy. One is the narrowband UVB therapy, which is a targeted light which helps to improve the melanin synthesis and eventually helps to stimulate melanocytes and to increase the melanin production to cover up the vitiliginous patches. Then there is the excimer laser, which is again the same principle of improving the melanin synthesis. Apart from them, there is something known as PUVA therapy, wherein there are tablets which contain sorelin, which is to be taken, and after 2 hours, the patient is exposed to the UVA light, which again is to stimulate the melanin synthesis and to improve the vitiliginous patches. There are some surgical procedures also which are done, which is basically there is a skin blister grafting as well as complete skin grafting. Apart from them, there is the melanocyte stimulation cell grafting. So these are a few treatments or methods which can be targeted for bigger body areas. And there is something known as sponge grafting also, wherein small pieces of the normal skin is taken and grafted onto the vitiliginous areas, followed by the UVB therapy, which gives quite good results. There are some other creams which can be used to camouflage the particular patches, and sometimes if it is a widespread vitiligo, then we use something which can completely demelanize the skin, that is known as monobenzyl ether of hydroquinone, which is known to completely decrease the melanin synthesis, and overall it will give you a camouflaged effect. So these are a few modalities which are used to target for the vitiligo. And apart from that, there is something known as PRP, which is platelet rich plasma, wherein the patient's own blood is taken and stem cells are separated from them, and after a minimal dermabrasion, the PRP along with the melanocyte culture is planted onto the vitiliginous area, and this is occluded. It's like a small surgery, and this is occluded for minimum 8 days, and after 8 days, once the graft and the melanocytes have been taken up by the body in the patch, and it is exposed to the UVB light, and along with some topical therapies, it gives very good results. So these are a few methods which we are using on a day-to-day basis to target vitiligo, which is quite a universal problem. But there are many therapies and newer researches which are being made, wherein in the form of therapies or maybe surgical procedures or drugs. The basic idea is to stimulate the melanocytes to increase melanin to target the vitiliginous area. So please take vitiligo as just a normal problem. It is not contagious. It's not a contagious disease. It's just a autoimmune process, and it can be controlled to a good extent if you seek the right doctor and take the right advice. And I say it should be a timely advice, and timely treatment will give you the best outcome. Thank you.